In this video, we're going to be looking at how to perform the high bar back squat with perfect technique. The squat is often called the king of the lifts, and for good reason. Before we look at the actual exercise, let's review some of the muscles that we'll be targeting throughout the lift. With the squat, we'll be targeting hip extension and knee extension, where the hips will extend to lift you up from the bottom of the hole position, and which will be done primarily through the glutes and some component of the adductor magnus, as it plays a large role in hip extension. The quads will be the primary component of knee extension. Other main areas will consist of the spinal erectors, the deep abdominals for bracing, as well as the gastroc and soleus complex. When taking a look at the main difference between the high bar and low bar squats, other than the bar placement, the high bar creates greater stress on the low back via shear forces in the lower lumbar spinal discs relative to the low bar. Therefore, lifters are typically able to perform the low bar lift with more weight. In addition, we see the high bar squat is more quad dominant. Because the squat is composed of mostly big muscle groups, it's very conducive to progressive overloads and should be trained with relatively heavy weight between 3 to 8 reps. Although there are some exceptions to this rule, just note we typically see compensations in technique as well as decreased muscle activation with lower loads for higher repetition. Let's take a look at what perfect technique should look like. When walking up to the rack for the first time, we want to position the bar on the rack so it's just above the nipple line. This will allow you to safely walk in and out without hitting the J hooks. As you unrack the bar, you'll want to place the bar on the meatiest part of the traps by squeezing the shoulder blades together. This is done by bringing our hands as close to our shoulders as possible. Another benefit to having our hands closer is you will have better control of the bar. When looking from the side, it's easier to see the elbow and hand wrist position. The angle of the elbow should be pointing down. We also want the wrist in a neutral position, which is actually slight extension. This allows good contact with the bar without excessively stressing the wrist, as it will take some of the load. Cervical, thoracic, and lumbar spines should all remain in neutral position throughout the entire lift. The pelvis should be in a pelvic neutral position prior to the start of the lift for proper spinal bracing. This will set the spine in a neutral position and provide maximal stability. As we continue down, we should see the hips and knees in full extension with the bar over the midfoot. When looking at the foot, either from behind or in front, we should see the heels at shoulder width apart, and the toe out angle is equivalent to the sacral angle or your natural toe out angle. Now that we are set up, we are going to separate the squat into 3 distinct phases: the descent, the transition, and the ascent. After assuming you are in a good starting position, you should begin the descent by unlocking your hips and pushing them backwards, allowing the knees to remain in line with the middle toe of the foot while having the bar continue in a straight down position over the midfoot. This allows the knee joint to be the axis of rotation, where little to no movement should occur here in the anterior-posterior direction and allow movement to occur only around the joint. As the hips sit back, the glutes, adductor magnus, and quads all eccentrically load to help absorb energy as well as protect their respective joints. As the hips come back, we should see the spine angled forward via a bend in the hips. This is completely fine and will not cause any excess stress, as the entire spine should remain in a neutral position throughout the entirety of the lift. When in the bottom of the hole, we want to make sure we still have a tripod stance throughout the foot, where there is equal pressure over the heel, great toe, and the pinky toe, creating optimal foot stability. As we approach the second phase of the lift, or the bottom of the hole, we should start seeing a few things line up. Most notably, the angle of the torso should be parallel to the angle of the shins, as well as the top of the thigh should be parallel to the ground. The knee should be tracking over the middle toe of the foot, and we should remain in a tripod stance on that foot. This phase occurs only a moment in time until moving into the final component, or the ascent out of the hole. The first thing you should do is extend your hips, in which your hips will move straight up. The knees will remain the axis of rotation in which the hip joint will move around the knee as the glutes and adductor magnets extend the hip. The knee will actually extend secondary to hip extension. The spine will remain neutral throughout the ascent, and you should see the hips finish the lift by tucking under the bar and bringing you back to that starting position. Now that you know what perfect technique should look like, let's break down some common technique errors and compensations we will see starting from the top. One of the most common mistakes I will see all stem from incorrect setup with the bar on the shoulders. Typically it will go like this. The athlete shrugs their shoulders to create stability in their upper back rather than squeezing them together. This will draw the scapula or shoulder blades into an anterior position or forward tipping, creating more stress on the front of the shoulder. With limited or decreased range of motion of the shoulder, you typically find the athlete using a wider grip. Athletes will typically hyperextend the wrist to have a better contact with the bar and extend the shoulders to create a false sense of stability as it is lacking from the shoulder blades. This is when we see the elbows are much too high for the back squat position. Once in this setup position, many athletes will continue to create compensations throughout the remainder of the lift. Before descending into the squat, many athletes who don't feel secure will hyperextend some or all parts of the spine to increase and create tension. This is seen by looking up or exaggerating the hip out or lifting the chest up. Another common compensation you'll see is the hips shooting up in the air or muted hips with the leg drive forward to increase tension on the quads as you push up rather than lift. Finally, one of the easier and most common compensations is the knee valgus, where the knees come inside the feet when standing up from a weakness in the hips. And one thing I want to note is these are not the only compensation that an athlete can demonstrate, but some of the most common ones I see when working with lifters. One last note to leave you with: recording yourself and or your athletes allows you to watch the movements later and gives you the ability to slow the movements down to really hone in on the technique. Sometimes it's challenging to see things in full speed and they can become very apparent when slowed down.